Imagine flipping a switch in your brain that brings back that spark, that drive, that youthful energy in the bedroom. No awkward pills, no fake promises. Just a deeper, more natural connection to your desire. Sounds wild, right? Well, this so-called magic nasal spray has been making waves, and today we're unpacking all of it. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. Hi, I'm Dr. Masha, a urology and men's health expert, and today we're taking a serious look at PT-141, also known as Bremelanotide, a peptide that's turning heads for claims like reversing erectile dysfunction, boosting libido, and giving men erections that rival those they had in their prime. And yes, I'll explain why some men are calling it their personal sex drive switch. But before we go too far, let's get something straight. PT-141 is not some new twist on Viagra or Cialis. Those work by increasing blood flow. PT-141, it does something completely different. And that's exactly why so many people are curious. Let's start at the beginning. PT-141 is a peptide, a tiny chain of amino acids. It was originally designed to help with skin pigmentation. But early on, something unexpected happened. The men in clinical trials started reporting spontaneous erections, and here's the kicker, without any sexual stimulation. That raised a few eyebrows in the lab. So naturally, researchers dove in to see what else this little peptide could do. What they found was fascinating. Instead of affecting blood vessels like traditional ED meds, PT-141 goes straight to the command center, the brain. Specifically, a little region called the hypothalamus, which helps control desire and arousal. In plain English, this doesn't just help you do, it helps you want to do. That mental spark that sometimes fades with age or stress. PT-141 aims to reignite it. Now, here's where it gets even more intriguing. PT-141 is what we call a melanocortin receptor agonist. That's science speak for it activates certain brain receptors tied to appetite, motivation, and yes, sexual behavior. This makes it especially helpful for men who don't respond to the usual ED meds. We're talking men dealing with psychological ED, diabetes-related issues, or just a plain lack of desire. And for those already on meds like tadalafil or sildenafil, PT-141 can bring in the missing ingredient, arousal, not just physical function, but the mental engagement that makes intimacy feel real again. Let's talk form, because this part trips people up. The only FDA-approved version of PT-141 is an injection, and it's actually approved for women with low sexual desire. The nasal spray you've seen online? Not FDA approved. It was used in early research but showed some safety red flags, like blood pressure changes and nausea. That's why it didn't make it to mainstream approval. That doesn't mean the nasal spray is always dangerous, but it does mean you need to tread carefully. Work with a provider who knows their way around peptides, understands the risks, and can help you get the dosing right. So what happens in the real world? In clinical trials, men using PT-141 reported a noticeable rise in libido. We're talking more frequent spontaneous erections, stronger mental arousal, and for many, a major boost in confidence and bedroom performance. But let's keep it real. It's not a miracle drug. Some side effects do show up. The most common ones? Nausea, flushing, and headaches. A few men also reported feeling a bit more tired or noticed an increase in blood pressure. That's why I can't say this loud enough. Never experiment with peptides like this on your own. Just because something is natural, bioidentical, or sounds scientific doesn't mean it's safe without guidance. Now, slow down with me for a minute, because this next part is where most guys start scratching their heads. PT-141 works upstream. That means it targets the brain, not the penis. So if your ED is mostly about blood flow problems, from poor circulation, high blood pressure, or diabetes, this might not be your go-to fix. But if your struggles stem more from stress, nervous system issues, porn-induced arousal problems, or you just flat out don't feel like it anymore, this could be a breakthrough. PT-141 may help rewire the brain's link to your body's natural responses. That kind of reconnection can be life-changing. It's not just turning on a blood switch, it's about waking up the part of you that wants connection, passion, intimacy, the human side of arousal. And yes, I get this question all the time. Can I take PT-141 with Viagra or Cialis? The answer is yes. In many cases, they're actually more effective together. PT-141 gets your brain and desire in the game, while the other meds support your body's vascular response. This combo is especially powerful for men with mixed ED, where both body and mind need a little backup. But again, don't go mixing things on your own. You need a licensed provider who can guide you. Let me tell you about one of my patients. A 56-year-old man with type 2 diabetes had been using sildenafil for years. Sometimes it helped, sometimes it didn't. His exact words, "My body's okay, but my brain's just not in it." So we added low-dose PT-141 injections once a week alongside his usual meds. Within 2 weeks, he said something I'll never forget. "It's not just working again. I actually want to be with my wife again." That's the power of treating both the mind and the body. Now, 2 questions I hear constantly. Let's clear them up. First, can you buy PT-141 online? Technically, yes. But here's the hard truth. Most of what's sold online is totally unregulated. Some products are mislabeled. Others are watered down or even contaminated. So unless it's coming from a licensed pharmacy under medical supervision, you're gambling with your health. Second, what about cost? PT-141 isn't cheap. Injections typically run between $30 and $80 per dose, depending on where you're getting them. The nasal sprays you see floating around are usually cheaper, but they're also less reliable and, as I mentioned earlier, potentially riskier. So, what's the bottom line here? PT-141 is a powerful tool, especially for men struggling with low libido, psychological ED, or who just haven't found success with traditional meds like Viagra. But it's not some magic bullet, and it's definitely not for everyone. If you're even thinking about trying PT-141, please start with a full evaluation from someone who actually specializes in men's sexual health. Get to the root of what's really going on. And from there, you can build a treatment plan that fits your body and your goals. Now, I get it. Not everyone's ready for injections. And if that's where you're at, I want to leave you with something simple, natural, and safe you can try starting today. One of the best ways to naturally support erections and stamina is by boosting your body's nitric oxide levels. And one easy way to do that? Watermelon extract. It's rich in L-citrulline, a compound that helps increase blood flow and supports healthy erectile function. I recommend this to patients all the time, especially those who aren't ready for medications or shots. And if you want to give it a try, I've linked a trusted, clinically dosed supplement in the description and the pinned comment. It's affordable, easy to use, and doesn't require a prescription or needles. I'm Dr. Masha, and whether you're exploring peptides, considering supplements, or just taking your first steps toward better health, I want you to remember this. Your sexual wellness matters. You deserve to feel good, confident, and connected again. Don't suffer in silence. The right solution is out there, and I'm here to help you find it.